Hi everyone, I'm Dr. Michael Johnson and welcome to our clinic here in Appleton, Wisconsin. So this is the Sanexas unit and we have one of the largest Sanexas clinics in the country. We have 10 units. You can see, if you watch my first video, we have lounge chairs. These are the lift chairs, so it'll lift the patient up out of the chair, along with heat and massage. They're up on our message board at txfibro.com. When you get a chance, get them because they're wonderful. As you saw in the video, and if you haven't seen it, I can list it below. But we have some biohazard matting down. We're getting a new floor in. We're getting this going as fast as we can. As mentioned, we ran a newspaper ad Sunday, Monday, Wednesday, half-page vertical. We ran it 2 weeks in a row, 409 appointments. So crazy good. There is a need out there. Some things that you need. We have this cart in the center of our work area, Sanexas work area, and we have some hydrogen peroxide wipes. This is really good, called Dermaplast. And I can show you the link. We just get off Amazon. But you spray it on. It's to help lessen the injection pinpricks that the patient feels. Electrolyte. This is really, really important. You can get it from Sanexas. Comes in a little pack. And we just got these bottles at Walmart. And half of the package of electrolyte with water. Not a big deal. Hand sanitizer. This jar we have gotten at Walmart. It's a jar of sponges. Now, Sanexas will tell you just need to use water. I like the 10-to-1 solution with it of water and alcohol. So 10 parts water, 1 part rubbing alcohol. These round sponges, if we get any blood on them, we just throw them away. They run like $2.50 a piece. We're looking for a better rate. So again, this is the unit, and what you're going to do is use the cups, and you should have all received your placement guide. And then Sanexas will have in the unit the placement guides that they use. So we can get you this guide also if you don't already have it. But what it is, it's the International Institute for Chronic Disease. So it'll say, for instance, like idiopathic neuropathy, week 1, 8, week 2, 3, week 3, 4, week 4, 2. What does that mean? Well, it means in week 1 for idiopathic peripheral neuropathy, you're going to set the Sanexas machine on 8. Program 8. Very simple. Folks, this is not rocket science. If I can do this, anyone can do it. So I'm going to give you the basics here today, and then my staff person, who's an RN, Jennifer, Monday, I'm making this on a Friday, she is going to do a little more advanced training with you. But I'll tell you, just what I'm going to show you here, we did with our patient population, and the first couple weeks before any advanced training, we got some phenomenal results. So again, Sanexas, it's high frequency, it's low frequency, it's frequency modulated. Most other units like the Hakamed, even a TENS unit, is amplitude modulated. So huge. All right, so you have it all plugged in. Now, what you're going to do is just reach behind and turn on the suction cups. That's what you've got here. You're going to take a sponge and place it in the cup. And then what you're going to do is spray it with electrolyte and get a good amount of electrolyte on there, maybe 4 or 5 sprays. Then you're going to place it on the patient. All right? So it's very easy to do, just on the patient. How do you know where to place it on the patient? Well, that's where the patient guides come in. And what we've done is just laminated a few Here's one for peripheral neuropathy of the lower extremities. Now you're going to see on here, it'll show you white, green, red, red and green. Shows you exactly where to place them. Again, this isn't hard to do. So what you're going to do is place it on the patient. You get it all set up. You'll turn on the unit. Now, if the unit doesn't come on, check the connections. What's going to happen is the unit will come up and it'll be, the system will be ready. And what you're going to see is the main menu. And I'll show you a picture of the main menu. Right there. So that's what it looks like. So what I'm going to press on that main menu is either it says programs page 1 through 4 or special functions. Well, if we're going to address idiopathic neuropathy, we know we need program 8. So we're going to go press program number 2, and that's going to show us a treatment program on page 2 that says NV8. And it's going to look like this. Right there. So you see where it says NV8. Now maybe you don't. But it's right there. And so what I'm going to do is just press that program button. Now the next thing that's going to show up is the page that shows, or the program that shows how much time. So let me show you what that one looks like. You give me a minute. I'm not the most technically advanced person in the world. I'll be the first to admit that. So here's what that looks like. And you can see here, it's going to start at 15 minutes. As long as I can get this to you. So it's 15 minutes. So what you're going to do is you're going to hit the button that says start time. And that's what I'm going to do here, or set time, I should say. Set time, and now 15 comes up. So what I'm going to do is press the positive button, the plus button, until I get it up to 30. Now here's the thing on treatment times. There are doctors that are just setting it at 20 and still getting great results. Now there are a couple programs here that won't let you go to 20, but you can start at 20 if you just have one machine. You got a lot of people coming in. Do 20-minute treatments, right? So we get that up to 30, we hit OK, and then what's going to happen is you're going to hit that positive button, that plus button again, and you're going to start the program. You're going to start the machine running. I'll show you what that looks like. So here again, there we are. We started at 15. And what happened was, let me get it up. We went up to 30. I don't know if you can see that. Okay, how do we do that? We press the positive button. The negative button will decrease that. And then we hit OK. Once we hit OK, this is what happens when you get older. Your eyesight starts going, so I got to take my glasses off. And what you'll do is it will start the program. So we've got it to 30. We just hit that plus. Once we've got there, we just hit the plus button. Let me show you what that looks like. It'll look like this. Right there. So all you're going to do is hit that plus button, and that's going to start the program. You've got the time set at 30. You can set it at 20, but it's the plus button, and away you go. Now what you're going to do is you're going to set the intensity. It's set here at 2, so I'm going to turn that up and keep turning that up till the patient can feel it. Now, some are going to feel it like at 12, others are going to feel an intensity of 20, others at 30. But you want to get them to where they can feel it and then just drop it back on down. So we get this set up, and say for instance, like I have an example here. We had it at, I can just shut this down now. We had it set at, I think it was just 7. And I'll show you. But this is what it looks like when you have a poor connection. You're going to see this right here. You can see it's set at 20. This is very beginning. I was just setting it at 20 minutes. That positive and negative button is going to set the amount of intensity. And so what's going to happen there is that you want to make sure you have a good, solid connection. And when you don't have that connection, you're going to see right here. All right, buddy, come on. Yeah, this is me and technology not working out. But you're going to see these 2 lines right here. There's 2 thick lines and 2 thin lines above. Those thick lines should be coming out and moving a lot more. And so what that means is you have a very poor connection with the suction cups. Perhaps you don't have enough electrolyte on the sponge. Perhaps it's just loose on the patient. And again, how do you know where the placement goes? You have the placement guide. So that's really all it is. Once you've got the cups on, and my staff will show you in the next video, all you're going to do is just wrap this around on the cup, this Velcro, and it keeps the cups either on the hands or on the feet. And really, that's it. That's all it takes to run this thing. Like I said, it's not rocket science. You can get excellent results with that alone. Now, like I said, Jennifer, in our next video, she's going to show you how to do some more advanced placements, and that's great. But we did this for almost a month, just the basic placements, and got some phenomenal results with people. Now, listen, do you really need to do the injections? Well, as long as you have the integrated model, yes, I would, because people are going to get better faster. But it will still work without the injections. You're going to get a patient now and then that won't want the injections. You're going to get a patient that will go vasovagal on you and they'll pass out. Don't freak out. Let me show you something. In Chinese medicine, if somebody passes out, you just press right at the bridge of their nose and they'll come back to. Same thing if you ever see someone go into a grand mal seizure, you just hold this acupuncture point. Keep holding it. Within 5-10 seconds, they'll come out of it. Nothing to worry about. The first time we had a patient pass out, one of our staff people, Hope, went screaming down the hall. So kind of freaked all the patients out. So don't worry about it. It's going to happen. Don't forget to wear gloves. I mean, this is a no-brainer. Something I shouldn't be saying, but I will anyway. Very important. Make sure all the connections are good. Make sure, we had a couple of these units where the metal plate had become disconnected. Now it will come out so you can clean it, and you see the little stub on there, but what had happened was the plate had broken off from that stub. If that happens, contact Sanexas and they will replace it for you. So that's it. If you got questions, just call me. My number is 920-740-3519, 920-740-3519. you're basing what program off this chart. And if you look at the chart, it's got Bell's palsy, it's got circulation, fibromyalgia, headache, inflammation. It's got one for wellness and maintenance, neuropathy, pain that's generalized, radicular nerve pain, sciatica. This chart right here, folks, is gold. This is the one. The placements can vary. So let me give you an example. Here's the placements for peripheral neuropathy. You see where it's up on the calf here? You can put these placements up higher. You can put one up higher, say on their left leg. If that showed up in the the punch biopsy, I'm trying to get it out. Let me tell you a story before I get done. We've been so busy that the Sanexas production manager, Sean Vance, wanted to come and see our operation, and Maria came out and she was training us up, and so we brought in lunch for the staff both days. Second day, Sean and I, we had ordered lunch for the staff from Chipotle. So we go marching into the restaurant, and I go up front and I say, order for Johnson. She goes, is it a to-go order? I said, yeah, Johnson, about 10 people. She goes, well, our online ordering is down. Do you have a confirmation number? And by this time, I'm a little frustrated because I'm busy. I got calls. We're in a hurry. I go, yeah, the confirmation is right here. And I show it to her, being a little bit belligerent. And she looks at it and goes, sir, we're Qdoba. Chipotle is across the street. And naturally, I apologized and went across the street and got Chipotle. So anytime you ever want to put me in my place, just say Qdoba. That's like code for don't be getting all high and mighty because you're not that smart. So, but this is probably the best machine. Let me just talk to you about this machine and my experience. And you know, we're 17 minutes in, and you know, you can shut this thing down if you like. But I was diagnosed with MS in 2009. In 2009, it wasn't good. It was really bad. About a year before, I had started with severe foot drop, and foot drop can be helped with Sanexas. I had started with severe sciatica, then peripheral neuropathy. I can tell you it was November 1st, 2008. That's how I remember it. And my problem, my MS, gradually got worse to the point where I could not stand, and I've been standing here now almost 20 minutes. I could not stand or walk for longer than 5 or 10 minutes. It was that bad. So I researched stem cell. I went out and had stem cell. Stem cell helped me. I mean, I can walk for 2 hours now, but I still had the peripheral neuropathy, the pain and numbness in the feet and legs. And I have been searching everywhere, high and low, trying everything, clearing mercury, clearing toxins, everything to get rid of that peripheral neuropathy. And to the point where I purchased 4 Haka meds, and we have 3 MLS lasers, we have 7 PEMF units, you've seen them on the video, trying everything for my peripheral neuropathy. Nothing has worked, nothing. Finally, Dr. Michael Glickert, my partner in consulting, in October 2018, he was going down. He was going bankrupt. He got in with a stem cell group, and they were just tanking him. So he found Sanexas. He immediately got into it. He now has a $2 million a year clinic, all staff driven, down in St. Louis. But he got into it, and he told me about it in like December 2018. A couple months, it was working for him. And he would just keep reminding me. And I'd be like, I'm too busy. We're very busy with our stem cell clinic. But now with the FDA and everything that's happening, Google, YouTube shutting down stem cell advertising. I mean, the handwriting is on the wall. I hope it doesn't go away. It's great. It helps patients. It helped me, but you don't know. So I was supposed to go out to a Sanexas seminar in Las Vegas, March of 2019. Didn't work out. My schedule. I'm doing a million things at once. And then finally, my feet got so bad over the summer of 2019. They were having a seminar at Mike Glicker's clinic in St. Louis for Sanexas, and I said, I'll be there. I went down and had 2 treatments, one without the injections, one with. I noticed a significant improvement in my feet. And it was one of those deals where this is so good that I bought into the company, meaning that I'm a distributor for it. I haven't seen anything that compares to it. Mike Glicker, when he first introduced it to me, he said it's a Hakamed on steroids. I said, well, a Hakamed didn't work for me. What do I care about that? I don't know how to describe it other than I haven't seen anything else like it. To the point, we have 10 of these units in our office. I just am going to sign a deal Monday. This is beginning of November. I'm making this video on November 1st. So Monday, November 4th, with a clinic up in Green Bay. The doctor's wife has seen us for stem cell. And, excuse me, she's doing better. He has a nice, beautiful clinic, but it's not very full. So we are going to take 3 of our units and move up to Green Bay. So we'll have 2 clinics already. And my eventual goal is the 10 units here, 5 in Green Bay, and then we're going around the state of Wisconsin. So I'm really passionate about this. Let's talk about some caveats. The minute you're watching this video, you should be getting credentialed with Daylene Lopez ASAP, because it's going to take you 4 to 6 weeks to get credentialed with Medicare if you're not already credentialed. It'll take 3 to 6 months to get into most major medical. Now, you can start accepting those Medicare patients and patients where they have out-of-network coverage. That's what we're doing. And then the people that are coming in that already have, HMO Medicare, you can't really accept it till you get into that HMO network, or your nurse practitioner does. Well, you just put them on a list. Folks, patients are used to waiting 3 to 6 months to get in to see the neurologist. They've been in your office, they've met you, and let me tell you, and I'll put this on another video, what my report of findings is. Mr. Jones, you have peripheral neuropathy. You've had it for 10 years. Here's a before and after punch biopsy, and I'll show this on another video. But here's the before, here's the after. Sanexas helps regrow the nerve. We do a vitamin blend injection into your legs to help the nerves. It works like nothing else I've seen. So you have a problem, we can help you. Your Medicare and secondary will cover. So would you like to have your next exam this week or next? It's that simple. It's that simple. That's the report of findings. There's no selling. Now the key to that is getting credentialed. Now what if you're not credentialed in the HMOs like we're not? Like I said, you put them on a list. You tell them the truth. Look, we're in the process of becoming credentialed, so this is paid for in full, or you have just a $10 copay. We will contact you as soon as we are there. And then if it's 2 or 3 months, you just have your staff call them every month, say, hey, we're still working on it, just wanting to let you know. Their pain, their peripheral neuropathy is not going anywhere. I can promise you that. This is the best thing that I've seen come along in helping patients, period, point blank. So we're just at the 25-minute mark. That's really as simple as it gets. The next video, my staff person, Jennifer, she's one of our RNs. She does the injections. She will go over some more advanced work with you, with the unit. We'll also be doing a video on the TM Flow. Some of you have the TM Flow. I highly recommend it. You want to do as much medical necessity confirmation as possible, and that comes with the ENFD, the punch biopsy, and it also comes with the TM Flow. So again, Dr. Michael Johnson, my number, 920-740-3519. Feel free to call or text, shoot me an email. I'm here to help you, and we'll see you on the next video.